Hey, let's try this again. I asked for 20 minutes from the start. So, I am so excited. How many of you guys are new injectors? Fairly new. No new injectors? What? Those are my favorite. I want new injectors here. How many of you are using a cannula? Good, but you guys are the easiest crowd. You made my job really easy. So, my name is Yvonne. I love business. I have a couple of them. And I'm here on behalf of Prolinium. So speaking for Prolinium, I speak for a couple different companies, and I have to go over my disclaimers. So today I'm speaking on Revanesse lips. So you can see that Revanesse Versa is for mid to deep dermis. I will be doing Revanesse lips, which is for the submucosal lip augmentation. And if you have any questions afterwards, you're welcome to come and ask me. Otherwise, if you have questions about the products, we send you back to medical affairs. Here are our learning objectives today. And I'm going to just jump right in because we have so much to cover. So for those of you who are not familiar with Prolinium, small business owners, who's a small business owner? Yes, I love it. Believe it or not, Aryo Koshbin started his business, Prolinium, in his mother's basement in, you can see, 2002 with a $300 loan from his mother. His mother opened up her own med spa many, many years ago. So he followed in her footsteps. He was working with devices and then later went into just strictly dermal fillers. So in 2008, he brought research home, and what he had done is he went and reverse engineered every dermal filler on the market and came up with the Revanesse portfolio. Now in 2024, he has over 300 employees and is in a facility of 70,000 square feet. So there's a lot of hope for us small business owners. Just keep growing, keep going at it. You never know where it might take you. So Revanesse is one of my favorite fillers. I'm not sure if you guys are familiar with the MOD report, but if you want to look up any complication to any of your dermal fillers, you should be able to find it on the MOD report. Now, I don't know if you're aware, but any complication that you have, you really should be reporting to the manufacturer and to the FDA so that we can have accurate data. But one of the things I love about this product is it's safe, it's predictable, it has longevity, and the unique features with this dermal filler is its spherical shape, and that decreases inflammation. So it has the high molecular HA weight, and then the long chain. So if you think of your dermal fillers, they all have HA and BDDE, which is butanediol diglycidyl ether. That's the cross-linking agent, and the goal is to have less BDDE so we have less inflammation. Has anyone experienced an inflammatory nodule in any of your patients? That's not ever nice, right? Especially during COVID, we saw a lot of that. Well, there's no reported nodules, inflammatory nodules with this product, and it integrates very, very well in the tissue. So the statistics now, where is our industry headed? You guys, our industry is growing rapidly. So some of you are new, right? I've been in the industry 10 years. And if you look here, our industry in the last 24 years has grown 50%. And most of our patients now that we're treating are in their early, 18 to 30s, where years before, we didn't go in for treatments unless we had a lot of wrinkles. But now we know we're doing more preventative work. But in the next 8 years, our industry in dermal fillers alone will be over $13 billion. So there's a lot of potential for us small business owners. So I'm going to just quickly go into the procedure overview. So when our patients come in, I always hand them a mirror and say, okay, what brings you in today? And I really, really listen to what it is they want. But then again, we have to have those realistic expectations, right? Because what they do is they pull out their phone, they pull up somebody on social media, and they're like, I want her lips. And I'm like, okay, girl, like, you were born with a Toyota Corolla. I can't give you Mercedes-Benz, but I'll sure try. And so we just want to be realistic with them, but we want to be able to achieve their desired goal ultimately. So my model here that I'm showing you, she's young, she's 19. So again, I'm using off-label, so she's younger than the FDA-approved indication of 22. And I always ask them, like, what is your budget today? Because it is these 19-year-olds in our chair. Like, can you afford the $400 mini lip that I'm going to give you? So I always just want to make sure that we're on the same page, we have clear communication, and I, of course, do a thorough health history. I do not and will not treat anyone under the age of 18. That's like a hard, fast rule for me. I've seen too many colleagues get in trouble doing that, so I just like protect my license the best I can. Okay, so some of the concerns we should be addressing with our patients. Human beings do not like uncertainty. So the more you can explain to your patients the whole process and what they can expect, more likely they're gonna have a great result. Now there's two things I never want my patients to experience. One is buyer's remorse, right? When they're like, oh my gosh, I spent all this money, my husband's gonna kill me, and they have to pull out 10 credit cards, a food stamp, and a prayer to Hail Mary, you know, like, oh my gosh, I just spent all this money. And so the other thing is I never want my patients to feel more self-conscious about themselves than before they sat in my chair. So with the technique I'm going to share with you today, they leave looking phenomenal. And we know that the product, if you're not familiar with Revenus lips, it's rehydrated, so they're not going to get edema and swelling like some of our competitors. And then we always want to discuss complications, right? How many of you are familiar with the Aesthetic ER kit? Okay, great. So I'm going to share a little bit with you on those protocols. But we always want to talk about infection. We want to talk about swelling. We want to talk about bruise migration. We want to talk about any asymmetry. And believe it or not, you can actually create beautiful symmetry with a cannula. And this product, because this product doesn't swell a ton. It's always that swelling that throws us off, right? We don't want to overfill. So with your photos, use your photos the best you can. Like, get the best photos you can, because truly that is what is going to build trust, build credibility, and you never know when you're going to be on stage and you're going to need to have some really good photos. So make sure you're using your photos to your advantage. And of course, you never know if a patient complains they're not happy with you and you get investigated. So make sure that your photos and your documentations protect yourself. So when I'm explaining to my patients the whole procedure, I literally lay it all out. We're going to clean you. I'm going to numb you if you want numbing, and that can be a topical numbing cream or that can be an injection. And then I'm going to go ahead and give you, I'm a very aggressive massager, and I'll tell you why when we get to the end. And then I want to make sure that they understand verbally and in written and in text form those discharge instructions so they're not blowing up my phone after the fact. So the cleaning product that I use is just hydrochloric acid. It is FDA cleared. It's very safe. It's non-toxic for eyes and ears. So it's a fantastic product. But I do tell my patient, I'm sorry, it doesn't look toilet roll camera. It is a pretty good product. Okay. Okay, so you guys, take note of this. It is the silliest, simplest technique, but it's like blew up on Instagram. It's a game changer. You know when your patients complain that their tongue is numb or that they swallowed it and they're like panicking because their throat is numb? Literally, take a 2x2 gauze, fold it in half, lay it on your teeth, and these were all supposed to play video. Let me go back. Can I get the video on this? So what you do is you just lay the gauze over their teeth, have them put their lip over it, then apply your numbing cream, and it won't get in their mouth. I promise you it's silly, but it's a game changer. Okay, so needle versus cannula. The research shows actually that your chance of a vascular occlusion with a needle is roughly 1 in 6,000, where with a cannula it's 1 in 40,000. So obviously it's much safer. You do get precision with your needle, fine control, versatility. You're going to have that bruising, you're going to have that swelling, and you're going to have a lot of vibration, especially if you're doing a 10-2 technique. And with cannula, so you're going to have less bruising, less swelling. It's much more tolerable. It's really not uncomfortable at all. And as you practice and get better at it, you can get more precise with your technique. There is a learning curve. And a minute ago, I had Dr. Gary Lee here. Did he leave? I'll talk about him in a second. Okay, so I wanted to break down the cost. So when I asked my patient, is this something you prefer? What's your budget we're working with today? I truly do start all my new lip colors on a mini. because with the Rockman's product, you have a 1.2 cc syringe. I dropped that to a 0.6, and I get a beautiful result. And you'll see my result here in a little bit. But really, what's your cost on that? Roughly $150 a syringe. If you add a cannula, maybe $2. Then you have all your indirect costs, your gloves, your supplies, your labor costs for your injector, maybe for asbestos, your overhead. So really, you should be talking, if you're selling it for $600 for a full syringe, about $333, and you're doing it in 20 minutes. So that's a pretty good profit. Okay, so here is my patient, 19-year-old female, never had lip filler before. I do a very thorough lip assessment. When they are young, they have better quality of skin, right? Much thicker tissue. So I do a full exam on the lips. I check inside the mouth, any sores, any scars, because scars are easier to improve. And I just really want to see what the overall texture and dexterity of the lips are. Now, if they're older, you got to be very mindful of that and use a 25 gauge pen versus a 27 because they will bruise more. And then you want to, when you're older, you're very gentle on that syringe, that plunger, not overdoing it. So here's just real quick anatomy, make sure you know where that labial artery is. So just a finger off the oral commissure, you have your superior labial artery. Be mindful of those little columnar arteries. I've seen a vascular occlusion there, and like within 2 weeks there was a scowl on the tip of the nose. So check your capillary refill at the columnar artery as well. Then you have those your lower labial artery, your horizontal and vertical labial artery. So here's my technique. I got 5 minutes left. So on my young patients, I use a 27 gauge cannula. A 27 gauge cannula is going to act like a needle. It's very, very sharp. So what I do is I take my lidocaine with epi just at the port. So 5 units at the oral commissure. And you can use a port needle or you can use a glide, whichever you prefer. And all I do is I enter the lateral oral commissure up into the cupid's bow, staying on the pink side of that border. And then I retrograde a linear thread, and then I'll come back into the body of the lip and leave another linear thread. So if they play the video, you can see, can someone play the video back there for me? Can you guys play the video? Anybody play the video for me? Sorry, you guys. I really want you to see this technique. Okay, if anybody wants to see my technique, I'll send it to you, okay? Okay, so Dr. Gary Lee was just here a minute ago. And it was such an honor, you guys. I learned from him like in 2015, a long, long time ago. So if you want to learn more about cannula, you can find his book on Amazon. Years ago, there weren't training programs like there are today, and I had to teach myself from a book. But he did teach me how to use cannula. It takes time to really fine-tune that, but the cannulas that I use are by Prolinium. They are the soft fill, and I will use anywhere from a 27 to 25. I never use a 22 in the lips. And again, you can use the glide or the needle. So I always use cannula on my male patients. Men do not want to walk around with bruised lips, ladies. Like, we can get away with it. We have lipstick, but they do not. So I never use needle on my men. They just want hydration. They just want a little more volume. As well as my older ladies, right? They're very fragile. They do not want to be black and blue. They do not want to go out in public feeling more self-conscious than before they saw you. Came and sat in your chair before they saw you. Okay, so here again is Bryn's before pictures. The video doesn't play. These are all videos, and I apologize. So during your technique, what I do is I literally tuck the mirror under their lap, and I let them peek throughout the procedure to make sure they're happy with it, because I don't want them having buyer's remorse or feeling self-conscious, right? I think we do a disservice if we just hand them the mirror when we're done with our treatment, because then they're more likely to freak out because they're like, holy crap. One, they feel big because they're so numb, and then two, they're like, okay, there is some swelling, there's some trauma there, but I let them be very, very involved with the procedure. And then I can ice intermittently throughout, and then just, distract with a Vibar or some music. But it really, this technique is it's like painless, really. So here's her after picture. So again, just a port a porthole on each oral commissure. She can go out into public. There's just some nice healing balm on there, and then side by side. So I always start with the cannula first. And the reason being is it takes away the trauma, it takes away that experience. It's such a better experience. And then 3 to 4 weeks later, you can see she still has a mild M-shaped lip. 3 to 4 weeks later, I bring her back. So this is her 24 hours, still no bruising, very mild swelling 24 hours later. And I bring her back, and then I fine tune with the needle. And look at the research here, 98.1% had like little or no swelling on their second treatment. So do the first one with cannula, go back and fine tune if you need the second time. So what I do, this is a video again that's not playing, and I apologize, but what I'm doing is I'm coming down and I'm filling that M-shaped lip to just bridge that gap of that volume loss there. Okay, aftercare, really, really quick, I have 2 minutes. Okay, who is checking capillary refill after every dermal filler? Yes. Somebody trained you really, really well. So make sure you document that. And I explain to my patients that bruises do not blanch, right? If you're doing capillary refill and it's purple, that's most likely a bruise. Okay, the 5 Ps, take a picture of this. I let my patients be responsible to know when it's time to come back to my chair. Okay, pain. Pain is a red flag. The only pain you should have is when I'm actually poking you. Then if it's pallor blanching, it doesn't always happen in your chair, it can happen after the fact. Purple, what's a normal bruise versus unnormal? Is it cool? It shouldn't be cool, it should be symmetrical all through with the temperature. And perfusion with your capillary refill. Okay, and you know how many times I get a video of the patient sending their provider a video? No, get them in your chair, get their butt in your chair and put your hands on them. Because if something goes south, you want to know that you were doing everything you could and you're not just trusting their video. This is the Aesthetic ER kit with all the protocols. And because life is better with beautiful lips, that's me, you guys. So I'm sorry, that was fast. If you have questions, I'm happy to stick around and answer any questions you have.